right. Hello, friends, and welcome to the August 26th edition of Weekly Witness, Texas Impact's weekly opportunity for mainstream Texans of faith to learn about public policy issues here in the great state of Texas and how they can engage in the policy process. My name is Scott Atnip, your host and Texas Impact's Outreach Director. Today's episode is brought to you by Methodist Healthcare Ministries of South Texas, and I'm excited today to be joined by Stacey Pogue, a Senior Policy Analyst on the Health and Wellness team of the Center for Public Policy Priorities. We're going to be talking about healthcare today. So Stacey, thank you so much for joining us.
Thank you. I'm delighted to be here.
All right. So in December, a federal judge struck down the Affordable Care Act in its entirety, as I understand. So could you please give us an update on what's happening with that?
Yeah. So this started probably more than a year ago. The Texas Attorney General, Greg Abbott, filed a lawsuit seeking to overturn the entire Affordable Care Act. He was joined by several other states. And the first stop was a federal district court in Fort Worth. And that judge, Judge Reed O'Connor, his ruling came out last year in December, at the very end of the year. And he found that the entire Affordable Care Act was unconstitutional and needed to be struck down. He issued a stay of his ruling, which means there's no practical effect of it immediately at all. The ACA is still the law of the land. People who have coverage still have it. But that, his rulings there, it's on appeal now. So the states that are stepped in to defend the Affordable Care Act, led by California and a bunch of other states, have appealed the ruling. It's gone to the Fifth Circuit. They've had their hearing. It was in July. They've had their hearing, and we're waiting on a ruling from the judges from the Fifth Circuit Appeals Court to see if they could uphold the entire Affordable Care Act. They could strike down the Affordable Care Act. They could do something that's in between, say parts of it can't stand, but other parts can. And it'll almost certainly be appealed, no matter what they say, to the Supreme Court. So we're expecting a ruling. This is a guess. We're expecting a ruling probably September or October. There's no guarantee. There's no deadline. But that's what observers expect, a fall decision. And everybody expects an immediate appeal to the Supreme Court if it doesn't get kicked back down to lower court. And also everybody expects another stay. Again, that means the law today, ACA is the law of the land today, and stays that way regardless of the ruling, and that the final ruling won't go into effect till it comes from the Supreme Court. So it is alarming. The ruling is alarming because the effects, if it eventually gets upheld, are catastrophic to people who need health care in Texas and beyond. But at the same time, the important thing to know is that there are no practical changes to coverage that's available or protections that are available while courts are working out the details.
Good. So a lot of us will turn into continue to be court watchers for the next few months and hope for positive results there. So one of the big things that people talk about, I know there are a lot of moving pieces with the Affordable Care Act, but a lot of the conversation tends to focus on folks with pre-existing conditions. And as a father of a daughter with a pre-existing condition, I am certainly interested in those conversations as well. And before the legislative session earlier this year, or maybe late last year, Governor Abbott pledged that, quote, Texans will be ready with replacement health care insurance that includes coverage for pre-existing conditions if the Affordable Care Act is to be struck down. So during the legislative session, did they make any progress on that? Is there a structure in place that could be used?
I'm going to answer your question and then give some background, because the answer is easy. No, they didn't do anything in the legislature. But importantly, to probably remind your members of lots of conversations they've had since 2010 when the ACA passed, just to make sure we have a common understanding. I just want to revisit what a pre-existing condition is and what it means to protect them. Mm-hmm. So pre-existing condition is any healthcare diagnosis, any healthcare need that exists that you know about already, right? And it doesn't have to be an overwhelming healthcare need that requires lots of care. Asthma is a pre-existing condition. High blood pressure, high cholesterol, diabetes, right? So they can certainly be chronic conditions that impact, your level of health or the way you interact in the world, but they can be things, again, like elevated blood pressure or elevated cholesterol that don't have any sort of immediate ramifications or need a lot of ongoing health care. And that actually means they're really common, right? You said your daughter has a pre-existing condition, but I bet most of the people listening to this do. In fact, if we're going by numbers, I bet half of us do. Half of Texans and half of Americans have a pre-existing condition, something in our healthcare record, our medical record, that would have had us either before the Affordable Care Act, we would have been turned down for insurance, or we would have been charged more. It's common, really common. So that's also why it really resonates with people. And in the midterm elections in 2018, you heard a lot of politicians talking about the need to protect pre-existing conditions. And in fact, it was right after those midterm elections that Governor Abbott said that the state of Texas would protect them. So in my opinion, what it means to protect them the ACA has lots of ways to protect them. And I think if the ACA is struck down, we would need to go back in and put all of those pieces together, not some of them. So the obvious ones are banning insurance companies from turning you down or charging you more if you have a pre-existing condition. And that's often what people, especially politicians, candidates for office, are talking about when they pledge to protect pre-existing conditions. They mean that discrimination piece from insurance companies, turning you down.
Right.
But that is not all we need to protect pre-existing conditions. Another thing we need is coverage in our health insurance policy for the thing, for your condition, right? So if your pre-existing condition is cancer, and your plan doesn't cover chemotherapy, it doesn't matter if they sold you the plan and you've got a card. It's useless to you, right? The same with mental health care conditions, right? If your pre-existing condition is a substance use disorder and you don't get treatment for that in your plan, it just doesn't matter. So that's the piece that's often left out when candidates for office or elected officials are talking about protecting pre-existing conditions. We both have to make sure insurance companies can't discriminate, can't treat you unfairly, but the coverage itself has to cover a broad range of things that people with chronic or existing conditions need. And then finally, the ACA did things like get rid of lifetime limits, right? There are some people with really severe conditions with really expensive treatments. There's some types of cancer, there's hemophilia, there's HIV/AIDS. There's some conditions where people used to hit their lifetime limits and their coverage just ran out. Once they'd spent $1 million or $2 million, there's no more coverage for your life, right? Under that policy. ACA got rid of that. So there's a bunch of other things that wrap around that central protection. And that's what we'll be looking for at CPPP if we have to talk about replacing the ACA's protections. It can't be one piece, it's gotta be all of those. Now back to the session. There were several bills introduced this session that would have done the easiest piece. It's not easy. The basic fundamental piece of saying insurance companies, you can't discriminate. You can't turn someone down. You can't charge them more. None of those bills went anywhere. So one of them had a hearing. One or two did, but that was it. They did not pass. Nor did you see, leadership in Texas fighting for them or talking about them. Or elected officials in the Capitol. It wasn't a big piece of the discussion this session at all, regardless of the governor's statement before session. So there was nothing done even on the most fundamental piece of pre-existing conditions. The one thing that even somewhat relates that passed was back before the ACA, Texas, like most states, had what we call a high-risk pool. It's an insurer of last resort. If you got turned down because you had a pre-existing condition by an insurance company, you could go to the state-created high-risk pool and get remarkably expensive insurance if you could afford it, but that it had comprehensive benefits. Very few people ever used it. 28,000 people at its max. This is at a time when Texas had 6 million uninsured people, right? The pool was never created as a meaningful solution to the uninsured or a meaningful vehicle for coverage for most people. It covered a few well-off people. And I'm really familiar with it. My mom was in the high-risk pool, and it was life-saving because even though she had to make terrible sacrifices to afford the coverage, her medicine without the coverage would have cost more than her premiums did, right? And she would have been terribly sick. So I know a lot about the pool. It is not nearly as good as the ACA protections that may say people with health conditions can get regular insurance in the regular pool based on their incomes, right? So there was a bill that passed that said, if the state needs to in the interim, before we come back in 2021, if the Commissioner of Insurance wants to start setting up an old high-risk pool, he can take some initial steps like pulling together a board, pulling together some bylaws, but there was no authorization for selling coverage from a recreated state high-risk pool. There was no funding attached for coverage. So it would mean that we'd have a couple months head start if we wanted to, as a state, recreate that old high-risk pool. We'd get a couple months head start with the planning piece. I don't want to sell that, nor as a replacement for the ACA. It is wholly insufficient as a replacement for the ACA. The author of that bill, Senator Hancock from the Dallas-Fort Worth area, meant for it to be a tiny step, to do the one tiny thing it was meant to do. He wasn't selling it as a replacement to the ACA or what Texas could do if the laws overturned. He just said we shouldn't get caught without this planning ability if we need it. He did not, nor did the governor, say that was a replacement plan. And if anybody said that, we would definitely make clear that the old high-risk pool was woefully inadequate and is no replacement for the ACA, and doesn't have excellent pre-existing condition protections. There was actually a pre-existing condition waiting period in our old high-risk pool. So it's a pool only for people who are sick. But some people going into it still couldn't get their healthcare needs met without paying premiums for nothing for a whole year. So again, the old high-risk pool is not a solution. Sorry, I feel like I might have gone off too much on that, but yeah.
That's helpful. Because I do think, if leadership is saying there will be a solution and is selling the high-risk pool as that solution, it's helpful for us to go ahead and start thinking about the fact that it's not.
That's why I spent so much time on it, because that's my fear and, frankly, observation, both from all of 2017 when Congress tried to repeal the ACA and some of the conversations in the state since then. That seems to be the answer that keeps bubbling back up, is we could have old high-risk pools. Every state used to have them. And I think it's important for people who are advocates for healthcare to be able to push back and talk about why that was so inadequate. Even though it was life-saving for the few people who could get in, it was a terrible it wasn't a broad solution.
So it doesn't sound like there was a mass movement this session to go ahead and protect people in case the ACA fails.
No, there was almost no discussion of it whatsoever. And that was actually kind of surprising, considering how much energy in the midterm elections right before session had been about healthcare. And then the governor's statement, there was almost no discussion on pre-existing conditions.
Well, so I know you said this earlier. It is important to remember that as of right now, everything is continuing as is. Nothing has changed as of now. And so that means Friday, November 1st of this year through Sunday, December 15th, the open enrollment period will run. Do we have any update on how that is playing out in Texas, or anything we should expect there?
Yeah, there's some initial things we know. At this point in open enrollment, there's more things we don't know than do. But we have some of the big ones checked off. So we do know that there'll be insurers selling coverage in every state through the health insurance marketplace. That's healthcare.gov. That's where people who have low and middle incomes can go and get insurance with a subsidy that can help them make coverage affordable. So most counties, most people in Texas will live in counties where they have a choice of 2 or 3 or 4 insurers. By far, there's very few people who live in counties where there's just one choice. And we know that rates are going down. That is not usually a phrase that I say that you hear. So I'm going to make sure rates are actually going down a tiny bit. It's essentially that they're holding steady. They're going down a couple percent. That is something that doesn't happen with health insurance frequently, because the costs of healthcare are always going up, and much faster than inflation, much faster than wages. And so it's unusual, frankly, in years when health insurance premiums go down. But that's what the initial filings show for Texas, is that most of the plans are reducing premiums by a couple percentage points, or holding them steady, or in a couple places in the state, increasing them by a couple percentage points. But it's a remarkably stable year for 2020 coverage. And that was pretty much true in 2019, too, for current coverage. I expect some insurers to expand to some counties they weren't in before, but those final announcements haven't been made. Insurers have talked broadly about some expanding, but we don't know which counties and which insurers. So we'll see. And then the other thing that's always a challenge in open enrollment is getting the word out, right? What we know from years and years of doing this is that coverage is affordable when people can get subsidies. So that's for people between the poverty level and 4 times the poverty level. And I'm going to check my spreadsheet so I do not get it wrong. So that's an individual who's earning about $12,000 a year to about $50,000 a year. If you have a family of 4, it's under about $100,000 a year, right? So those subsidies go up to middle incomes, right? To moderate incomes. There's a whole bunch of people who do not know that they could qualify for lower cost insurance. But what we know from years of doing open enrollment is that when people do get those subsidies, they report that they can afford the coverage, right? And I think a lot of people are surprised when they've looked at health insurance premiums before, that when they go in the marketplace and enter their income information, that coverage is affordable. So what we know is we have a lot of work to do on outreach and education about the marketplaces available, the subsidies are available, not least of which, because that court case we just talked about, we're expecting a ruling right before open enrollment. And even if all the messages are, hey, this ruling doesn't go into effect right away, everything's the same, people are always confused. Do I keep paying my premiums? Can I sign up on November 1st? So the timing of the expected ruling will create chaos, right? And create confusion. And that's nothing new for ACA open enrollment, but we have to start thinking now about how to give accurate and reassuring messages to people in our communities. But it'll start up November 1st, again, regardless of what the court decides. Everybody thinks it'll be appealed and stayed, so open enrollment should go through. We'll have lots of coverage options in Texas. The premiums are holding steady, and when people get subsidies, they find that the coverage is affordable, right? That's what they report. And we've lost, even with all of the attacks on the Affordable Care Act, all of the confusion. People who have subsidies aren't disenrolling, they're not dropping out, they're coming back year after year after year. It's meeting their needs, they're affording it. People who make above that $50,000 as an individual or $100,000 as a family of 4, we are losing people at those higher income levels who are having a hard time because we have premium increases for a couple of years in a row, but not when people can get subsidies. So there's a big role there in amplifying the messages about coverage is here. It starts on November 1st, and check out if you can get a subsidy.
Yeah, so we've got a lot of church folks who listen to this and people in congregations that soon after the Affordable Care Act passed did a lot of work to educate their local communities. And I just go ahead and put that challenge in to us that even though it's been around for almost a decade, like we have to keep doing that work each and every year. So congregations, folks who are listening, please go ahead and start promoting that availability on November 1st. And is one of the messages, just based on the numbers you went through, is one of the messages that it's working?
Yeah. I think one of the most important messages is that it's here, the marketplace is still here, and that there's financial help to make coverage affordable. Those are the things that people those are the basic stumbling blocks through focus groups where people are getting confused, is whether it's even still a thing, right? Whether the marketplace is available or coverage is available. And the other big one is that people just they have not heard and do not know that there's financial help available for folks who need it. And that when you get that, coverage is affordable. And especially given the confusing court ruling, whatever it is, making sure people in your congregation and your community know those basic facts is really helpful.
Yeah, so the challenge has been laid down, folks. Let's get that information out there. So we have a lot of people and congregations who are listening who are interested in making sure that everyone has access to quality, affordable healthcare. Besides promoting the open enrollment, what other steps should people who are listening take during this interim period if quality health insurance is a goal?
Yeah, I'll point out too, I think the most important and transformative opportunity we have at the state level for coverage would be expanding Medicaid. Most states have done it. I think Texas is now just one of 14 states that has an expanded Medicaid. And states have done it in a variety of ways. They haven't necessarily just done a straight Medicaid expansion. There's a bunch of conservative states that have found different ways to incorporate conservative elements, but still ensure that there's health coverage for people who are poor. So when I say Medicaid expansion, I mean there's a group of people who, it's kind of hard to believe, they earn too much for Medicaid, but they earn too little to get subsidies in the marketplace. It's just a glitch that happened from when the ACA was written to when the Supreme Court upheld it the first time, and Medicaid expansion became optional. As written, it wasn't optional. Everybody had a coverage option, right? But as after the Supreme Court ruling that made Medicaid expansion optional, we created a gap of people that is 800,000 Texans who are poor. They're in poverty or near the poverty line, who have no affordable healthcare options. And so, usually you talk about people make $1 too much and they can't afford food, can't afford, healthcare. But this time it's people who are earning less than people in the marketplace. So we have fought alongside Texas Impact and lots of other allied organizations for years to get state leaders to take that option. It can be done with, at probably no cost to the state budget. It's already been done by most states. There's a bunch of economic reasons. There's a bunch of moral reasons. But we need leadership. State leadership hasn't agreed to do it yet. And so we're part of a campaign. Texas Impact is part of a campaign to push state leaders on that. And so I would recommend, if you want information about that, to sign up for Cover Texas Now. That's the organizational name that we all come together under a coalition. CPPP is part of it, Texas Impact, and a lot of other partners. And our highest priority is passing Medicaid expansion, and again, giving 800,000 Texans with very few means access to health coverage. And hopefully we'll have another opportunity to be able to do that in the next legislative session. And we've tried for several, but we're working a lot on trying to change the narrative around health coverage and ensure that it rises to the top of the pack next legislative session. For people who have a lot of time on their hands and want to do healthcare, there's a subset of that group called the Health Activist Leadership Network that's training people, activists, to organize at the community level to push for Medicaid expansion and healthcare coverage. It'll be a few people that have the kind of time and ability to commit. Most people, I think what's important is that you're getting your calls to action from Texas Impact or Cover Texas Now and picking up the phone when we have a vote that matters for health coverage, or asking candidates at the candidate forums, leading into the next year's elections. And we'll make all of those kinds of resources, questions, calls to action, available through the Cover Texas Now website and listserv. And I think that's what's really important to point to. And if eventually this court case comes back and the ACA is struck down, I will have many more things to recommend to you guys. That should be probably summer 2020 is the expectation, right before the 2020 elections. What we're calling for at that point will change radically. But I think, in general, we're trying to elevate the conversation around healthcare and the expectation around healthcare for 2020 elections.
Yeah, I think that's important. And we certainly sent out a lot of rapid response notifications and that kind of thing during the session. But this is the time of year, for the next year, really, that we need to be having conversations with our members and their districts and candidates for office, making sure that they know that this is a priority issue moving into the 2021 legislative session. So we need to spend the next year talking about it with our members so they know it's important. So let's get to work, y'all. So anything else you can think of that folks should be doing or that Texans of faith should know on healthcare this week?
I think those are the important things. Have you guys talked separately about public charge with immigration, I assume?
We haven't, and we'll be talking about that more. Anything you want to add there today?
I'm not maybe I shouldn't have brought that up. I was like, I don't have the best talking points. I just want people to be aware that it won't be a surprise. It doesn't matter which rule it is. The chilling effect from all the anti-immigrant rhetoric is such that people are making some pretty hard decisions about disenrolling their kids in healthcare or their families from food assistance. And what I wanted to recommend is that people, learn about that and then try to give accurate information and make resources available or give people referrals to accurate sources of information. Because families are making very hard and heartbreaking choices, but we want them to do it with the right information about before they disenroll kids from healthcare.
Yeah, and there were a lot of national faith groups that made statements on the public charge, and we posted a link to those in our e-news, I think, 2 weeks ago. So you can find that, and we'll certainly be talking about it more in the weeks to come. Many of you know that we're going to the border with between 80 and 100 clergy this week. And my guess is that will come up. You can follow along with those conversations on our Facebook and YouTube pages. And we'll have some clips of that for Weekly Witness next week during the holiday week. But Stacey, anything else you'd want to shamelessly plug today?
No more shameless plugs. I really appreciate the time.
All right. We appreciate the work that you do. We always appreciate all of you over at the Center for Public Policy Priorities for the data and information that you're pushing out all the time. Where can we find more information on you and your work?
I'm at cppp.org. That's Center for Public Policy Priorities. And even higher than that, in this setting, I will recommend Cover Texas Now. We've got, that's where all of our healthcare work is housed. And again, it's not just HPP, Texas Impact, and a bunch of coalition members have their information consolidated there. But that's a great hub for information on what's changing in healthcare. What does that latest headline out of DC mean? And what action can you take?
All right. Well, Stacey, thank you so much for taking the time to join us today, and thank you for all of the work you're doing each and every day to make Texas a better place for everyone. Friends, that does it for this week. I hope you enjoyed the conversation as much as I did. Please make sure when the podcast comes out to go ahead and rate, review, subscribe, invite your friends to do the same. Make sure that we have a movement throughout Texas who's engaging on these issues, who's talking to their members about the importance of ensuring that everybody has access to quality, affordable care. So share this with your friends, get your congregations involved. And if you've made it this far in the broadcast, you obviously appreciate the work of Texas Impact, so make sure you and your congregation are members. You can do that by going to texasimpact.org/join. Thank you so much for tuning in. Again, next week is a holiday week, following a week where we're going to be with faith leaders in the Valley. So we will have some highlights from that on the podcast feed next week, so make sure to tune back in. Until then, let's get to work. Thanks, friends.